Still, as national headlines had reported, particularly amongst white Protestant evangelicals, COVID-19 infections and deaths did come to this faith community. And as reported by the Washington Post, by the first Mother's Day in pandemic, George Graveson, a member of the First Baptist Church of Alexandria, had believed that he must have picked it up at the grocery store or somewhere. But he was not sure from where. Still, former Governor Ralph Northam of Virginia had heard reports about these hotbeds of infection. Mr. Graveson told the Washington Post if one person in the family was set up to get hit hard based on age or whatever, it was probably going to be him. His son, Matthew, told the Washington Post that they had been so very careful. Yet this kid, who was the example of a young and healthy young man, and who had worked out all the time, soon found himself and his brother on a respirator, while prayer rocks were placed by believers were reportedly seen outside the Graveson family home in Alexandria, holding steadfastly to the power of prayer to deliver them from this calamity. As indeed, as many as 24% of atheists, statistically tending to be far more educated and intelligent than religious people, began to pray for an end to the pandemic, according to the Pew Research Center. But even salesmen know that hope is not a plan. And towards the end of the run of the first COVID-19 variant, apparently while undergoing a catheterization procedure, the Graveson family's pastor at an evangelical Christian church, Reverend Don Beyer, too, had caught COVID-19 and had in turn apparently infected his wife, Audrey, in January 2021. We had both tried so hard to stay well during the pandemic, said Reverend Davidson. We did everything you're supposed to do, not just social distancing and masks. His wife, Audrey, would even wipe down all of the groceries she'd buy before putting them in the pantry or refrigerator, perhaps having heard the terrifying reports of grocery store infections from Mr. Graveson. And according to Reverend Davidson, my best guess is that I was exposed to it at the hospital when I had my catheterization on January 13th. His best guess. For by Friday, January 22nd, they both had rapid tests at Inova Urgent Care in Vienna, and the results had come back positive. According to Matthew Graveson, the son of George Graveson, everybody kept saying that what happened to them was a miracle. Having caught COVID-19, gone through respirators, in the hospital and survived. And he says he knows that's true. But another part of him was asking, really, you think I'm lucky? Because I don't always feel lucky. And even the Washington Post, reporting the story, had asked, how is this possible? What are the odds? And at least according to the World Health Organization, after their robust review of the outbreak in China, dispatching some 1,800 teams of at least 5 epidemiologists to examine 55,924 laboratory-confirmed cases in China, reported by February 20th, 2020, 19 times more cases examined in China than had yet been reported in the entire United States by mid-March 2020, when the former Virginia governor began to lock down the entire state after a report of the first fatality, but only a total of 45 cases statewide, less people than can fit on a bus. The chances of anyone catching the first variant was less than 5%, about your chances of getting into Harvard if you are even competitive enough to apply, or winning a 35-to-1 payout on a 2-number combination at roulette at the MGM National Harbor Resort Casino. Those epidemiologists from the WHO had concluded in a 40-page report that it is not clear whether this correlates with the presence of an infectious virus. But even its author, Bruce Aylward, assistant WHO director and veteran epidemiologist, by March 2020 had told Vox Media, "I think people aren't paying close enough attention," being quite polite and diplomatic. According to that WHO official, people keep saying the cases are the tip of the iceberg, but we, using empirical methods, as scientists, couldn't find that. According to that veteran epidemiologist, Bruce Elwood, the assistant WHO director, getting the virus is a function of whether someone's got it, how long they're exposed, and how much virus they are shedding. So a simple question to determine exactly how much virus George Graveston may have picked up at the grocery store before infecting his wife and 2 sons might help us to discover the answer. Perhaps a simple question to determine exactly how much virus Reverend Davidson may have picked up while undergoing a catheterization at the hospital according to his beliefs before passing that infection on to his wife, Audrey, especially since there were practically no hospital outbreaks anywhere in the entire United States. Wow, quite aberrant from presentations in other parts of the world, except for at veterans care facilities and nursing homes. All religious people have beliefs, which we are all too aware, but pandemics are like a science. And according to Jasper Fook Wu Chan, a scientist who had performed a challenge study using Syrian hamsters early in the pandemic, he had required between 100,000 and 10 million particles just to infect that small furry creature. 10 million particles would be the equivalent of a period at the end of a sentence magnified to a diameter of more than 555 feet across, while the smallest dose required to infect that hamster would be the equivalent of a stroller measuring 5 foot 5 inches across, and at least 100,000 particles in infectious dose has been required to infect everything from transgenic mice to rhesus monkeys, the closest thing we have to human challenge studies, practically ruling out those animals as potential reservoirs for a natural spillover because it takes only 50,000 particles, half that, to infect the most resistant human with anthrax, and not even the CDC has published guidance that anthrax is a communicable disease between humans. Yet, had performing whatever activity Mr. Graveston had in fact caught COVID-19 while going out to the grocery store, and instantaneously thereafter had infected his wife, would require such a large volume of virus that he would have killed her by asphyxiation long before he ever had infected her with COVID-19, that respiratory tract infection disease, and the same for Reverend Davidson and his wife. But while a highly contagious disease capable of setting off a superspreader event, according to the science, without which none, requires no more than 15 particles in infectious dose, according to the CDC, the official guidance is that the infectious dose of SARS-CoV-2 needed to transmit infection has not yet been established. And maybe prayer stones actually worked for them. When I was a child, I too spake as a child. I understood as a child. I thought as a child. But when I became a man, I put away those childish things. Can I get an amen? This message was approved by Major Mike Webb. Honest. This has been a Filmways presentation, darling. And y'all come back now. Yeah.